The issues affecting you. Revealed, explained, discussed. Now on WGAL 8 in Focus.
Hello, I'm Susan Shapiro. As coronavirus cases rise across the country, the U.S. is on the verge of vaccinating people in all of our states. Tonight, we'll talk to two infectious disease specialists in the Susquehanna Valley about how their hospitals are faring and what they think about the vaccine and how it will be administered as we continue to bring coronavirus in focus. I'm joined now by Dr. Catherine Paulus, who's an infectious disease specialist at Penn State Hershey. Thanks so much for joining us once again.
Thanks for having me.
Boy, this has been a long road. What are you finding now in terms of the patients you're treating at the hospital?
I think we've now reached what many of us were very concerned would happen all along, and that is just enormous volumes of patients with COVID-19 that are severely stressing our healthcare system as well as our providers. So it's been a very challenging past couple of weeks.
When you say, severely stressing, what does that mean to you? What happens?
Yeah, so we are, we've obviously planned for this all along to make additional beds available and to staff our ICUs and to staff our floor beds. But one thing to just keep in mind is that even though we can make beds and we can, sort of provide that level of care, there are only so many healthcare workers with that level of training. And so right now we are, taking excellent care of our patients, but we are reaching a point where we're very concerned about staffing and our ability to really manage patients moving forward.
It's not like someone can just step into that role immediately, I guess.
No, I mean, people have over a decade or more of training to do these types of jobs. And, it's very challenging to build that expertise in this kind of situation.
In terms of patients, what are you seeing? Are patients as sick as they were months ago, or are they having less severe illness?
We are seeing a lot of severe disease. I think we're better at taking care of patients. We have more experience. We have better tools, things like the medication remdesivir and different immunomodulators like dexamethasone. That certainly helps patients, but we are still seeing numerous critically ill patients and we are having deaths. And it's just staggering to me, the number of deaths that we've seen this week across the country from COVID-19.
And how about at your hospital and here in the Susquehanna Valley in terms of deaths?
Yes, absolutely. We do see deaths here, and we've seen a number of people on ventilators. It is really hard to see this, and I think all of us are struggling with seeing this acuity of disease and its impact on our patients and their families.
If you're telling me that your treatment has improved over these months, so why are people still dying of this disease?
Well, this is a very severe disease. The more people that get infected, the more deaths we'll see. We've made improvements, but we are still in very dark times and more dark days ahead.
And what is that like for you, Dr. Paulus, and the rest of the staff there?
It's crushing to me. I see people and they say, 3,000 deaths a day from a disease, like that's just a number. These are, people's moms and dads and grandparents and children. They have families and they're wonderful people. And we're seeing death like we've never seen. I don't know that any of us were prepared for this.
Yeah, and I just talked to a group of nurses in Lancaster, and they said some of the hardest parts of it are that these people are alone. You're the only ones they have there. Their family isn't there.
That's correct. That is really a struggle as well, and something we're not used to. And it's crushing for these people and their families and for all of us.
Well, I know the vaccine is on the horizon. Hopefully it will be given to a lot of Americans soon. Stay with us, Dr. Paulus. We'll talk more about that and how Penn State Hershey is going to handle that administering of the vaccine.
This is WGAL 8 in Focus. Coverage you can count on.
We continue our conversation with Dr. Catherine Paulus, who's an infectious disease specialist at Penn State Hershey. Dr. Paulus, the vaccine appears to be on the horizon. What are your thoughts about that?
Well, I think this is the first bit of good news we've had throughout this pandemic. And To see vaccines coming forward with reported efficacy of over 90% is more than any of us anticipated.
What do you think about the way this vaccine was developed? This is a new form, this messenger RNA. What are your thoughts about that?
Yeah, so I think we learned a lot about coronaviruses, starting with diseases like SARS and MERS. So we were able to build upon that expertise to make vaccines that target what's called the spike protein. That's a particular protein on the viral surface that the immune system responds really well to. And how these vaccines work is they introduce a bit of genetic material into your cells, and your cells produce this spike protein. That allows your immune system to respond and to protect you against further infections from the coronavirus without you actually ever being infected with the virus.
And this is certainly not affecting your DNA in any way, as I've heard some people express concern about.
Correct. This does not integrate into DNA, and instead it stays in the cell cytoplasm. And after it translates into protein, it's then degraded and gone from your system.
So what's your hope as far as what this vaccine will do?
Well, I'm hoping that this will be the tool that we need to really change the course of this pandemic. And of course, that will mean that a lot of people need to get this vaccine to get to what we call herd immunity, so that the virus is no longer circulating as robustly in our population. I think it has the real potential to avert deaths from COVID-19.
Does a vaccine like this have even more protection than having the disease itself?
Well, that I don't think we know the answer to yet. And there's a lot of information that we'll need to learn about these vaccines. For example, how long do they protect you? We only really have short-term data right now. But still, this is an excellent, excellent first step towards ending this pandemic.
You do hear some people concerned about taking a vaccine like this. Should they be?
I understand people being concerned. This is a brand new virus and a brand new vaccine. I think the things that should be reassuring to people is that so far in the trials, and the patients have been followed out to about 2 months, there have been no serious safety signals. And that's very reassuring for me. Now, we may see longer term side effects or very rare side effects. That happens, when we follow vaccines longer term and when they go into very, very large numbers of people. And that is why I'm very, very happy that the federal government is taking steps to monitor safety as these vaccines are deployed. And the benefit of getting a vaccine that gives you 95% protection against COVID-19, I feel that outweighs the risk of a very rare side effect.
Yeah, my understanding is with a vaccine like this or other vaccines, the long-term effects are pretty slim.
Yes, very much so. Most vaccine side effects are seen in the first 6 weeks after an immunization is given.
Now, we have seen, at least heard from England giving the vaccines, that there have been some allergic reactions in a couple of people. Is that a concern?
Well, I'm looking forward to hearing some more information about that. And I'm hoping that the FDA will comment on that as well, when they review these vaccines.
What do you plan to do in terms of a vaccine and recommend to your patients and to others?
Well, I personally will be getting this vaccine, and I'll be recommending it to my family as well as my patients, as long as they're able to get it.
All right. Well, very good. Thank you, Dr. Paulus. I know it's been a long, however long it's been, many months for you and your team there.
Yes, we appreciate it. And thank you very much for having me today.
Thank you. And stay with us. We're going to talk to another infectious disease specialist more about the coronavirus.
This is WGAL 8 in Focus, coverage you can count on.
I am joined now by Dr. John Goldman, an infectious disease specialist at UPMC. Thanks so much for joining us.
Thank you so much for having me.
Dr. Goldman, first off, let's talk about the hospital. What are you seeing at this point at your hospital?
We're seeing a large increase in the number of coronavirus patients coming in. We have seen our volumes probably double or triple since the start of November, and we've seen an increase in patients who have been hospitalized as a result. We are seeing, because we take better care of people, we are seeing lower mortalities. We're seeing fewer patients in the intensive care units. We're seeing fewer patients on ventilators. We're seeing fewer patients dying. On the other hand, because we have just simply a higher volume of patients, we're seeing a whole lot more in the hospital. We're seeing our intensive care units get full. We put people on ventilators more slowly, so we don't have a lot of patients on ventilators, but we are seeing a real increase in the number of patients in our area.
What are your concerns about that increase in volume?
We always have a concern where it's going up, and it's been going up essentially since early November. We got a surge after the election. We're expecting to see a surge after Thanksgiving. And our concern is it's going to continue to go up. Our concern is it's going to strain our resources. What we really need is people out there to realize that there is a real high rate of transmission in central Pennsylvania. We used to see maybe 1 out of 10 patients who were symptomatic be positive for the test. It's coming up close to half. So there is a lot of coronavirus out there. As a result, we need people to mask. We need people to social distance. And we saw a real increase after the election. We expect to see a real increase after Thanksgiving. So we need people when they gather for the holidays to really social distance, to have small gatherings. And if you're with people that you're not normally with, if you're with people outside of your family, you do really need to mask.
The governor has warned that hospitals like yours may not be able to treat people who have other conditions other than COVID. Is that a concern?
We are making every effort to continue to take care of COVID and the community. One of the things that we learned in the spring was when we shut down, when we stopped doing elective surgeries, we delay care. We sometimes cause bad outcomes. And for example, I don't actually like the term elective surgery. No one gets up in the morning and says, I think I'd like an operation today. So people generally don't go in for a surgery unless they really have to. So there are some surgeries that aren't emergent, but for example, you don't want to delay a biopsy for breast cancer. You don't want to delay a cancer operation. And so we are really making every effort to both take care of the COVID patients who are increasing and the regular medical needs of our community. Again, in order to do that well, we need the public support. We need people to mask. We need people to social distance. And we need the number of cases to stop increasing. We're not going to get those cases to stop increasing unless we have support from the public, unless people do what they need to do.
A lot of people are saying, okay, well, there's now a vaccine on the horizon. What are your thoughts about that? And we'll talk more about the vaccine, but just wondering what you think about the fact that this is on the horizon.
To me, the vaccine is a good reason to social distance. We are better at taking care of people with this disease. Your chances of dying are less. They are certainly not zero. And if you're older, if you have multiple medical problems, they're a lot more than zero. And the way I view it is everyone who doesn't get the illness, doesn't end up in the hospital, doesn't end up in the intensive care unit, and doesn't die this season is a life saved. Because if you get your chances of getting this disease during the next 6 months are likely to be much higher than your chances of getting it anytime after that. We are likely to see our lives go back to something close to normal. So in my mind, if we can just keep doing this for roughly 6 months, if we can just keep doing this till the vaccine becomes available, everyone who doesn't get sick and die this upcoming season is really a life saved, is really at much less chances of dying after the vaccine becomes available. This is the most critical time, not the least.
Good point. Stay safe until you can get the vaccine. We'll talk more about the vaccine and your hospital's plans to administer it when we come back.
This is WGAL 8 in Focus. Coverage you can count on.
We continue our conversation with Dr. John Goldman, an infectious disease specialist at UPMC. Dr. Goldman, what are your thoughts about these two vaccines at this point that look to be on the horizon, at least for folks in the U.S.?
So my thoughts are, first of all, they appear to be incredibly effective. Both the Moderna vaccine and the Pfizer vaccine are effective in the 95% range. That compares to something like 60-70% for the flu vaccine. These appear to be very effective vaccines. It is still very early, but they appear to be very safe vaccines. In addition, we're giving these vaccines for a disease that is currently killing more than 2,000 Americans a day. So your risk of getting sick from corona, your risk of getting hospitalized, your risk of dying is actually very high. And the vaccines are early. It's likely that we will find some side effects that we're not yet aware of. On the other hand, there are a lot of people actually dying from the disease that the vaccine prevents. In my opinion, the risks of the vaccine are far outweighed by the risk of the disease. I personally will take the vaccine as soon as it can be put in my arm.
Likewise. But the hospital you work for has said they will not mandate it for employees. Do you think that's a good idea, or why is that?
Well, first of all, this is a new vaccine. So in contrast to the flu vaccine, which we literally have years of experience with, this is a vaccine that's new. Often when you have a new vaccine, risks that we're not yet aware of come out. And so we do not plan on mandating it. That may change after we get more information, but for the foreseeable future, we will not mandate the vaccine precisely because it's a new vaccine. Again, I think not taking it is foolish.
A lot of people have said it's been rushed. They're concerned about that. Do you think corners have been cut, or is this the same kind of strategy that has been used with other vaccines?
They developed this vaccine very quickly, and it's early. We haven't started giving it to the population yet. We haven't given it to 100 million people like we have with the flu shot. On the other hand, from everything that I can tell, everything that I'm told by the people at UPMC and UPMC Pinnacle reviewing the vaccine, it's very safe. Anytime you have a new vaccine, there are more risks. On the other hand, I do not think that the process was rushed. I do not think that there is any hint of real serious safety concerns with it. And I do think that there are real dangers from getting the disease that are much higher than the chances of getting the risks of getting, for example, the flu. There are clearly slightly more risks from the vaccine simply because it's new. On the other hand, we've had roughly 10 times as many people die from this disease so far as die in a typical flu season.
Yeah.
So the risks of COVID-19 are very high. I believe the risks of the vaccine are very low.
All right. What kind of challenges does distribution and administering of this vaccine present? The Pfizer vaccine has to be kept at super cold temperatures. Does that make it more difficult than, say, the typical flu vaccine?
Absolutely. It has to be kept at, I believe, -93 Fahrenheit. That's essentially Arctic temperatures. Not everyone has a sub-zero freezer. You can put it in dry ice and keep it, so it's harder to distribute. As I understand it, we'll be distributing the Pfizer vaccine, which needs to be kept at -93 to hospitals, which are clearly will be able to keep it at those temperatures more easily, and the Moderna vaccine, which still has to be frozen, but with a higher temperature, to nursing homes. And then there's simply the logistics of getting it, the logistics to getting it to a large number of people, and who we prioritize it to first. We're obviously going to give it to frontline workers who are COVID facing, who are at the highest risk of the disease, and then gradually begin giving it to other healthcare workers, other healthcare workers who are at high risk of the disease. And there's a lot of thought and a lot of effort into being put into how we do this properly and how we do this fairly.
All right, Dr. Goldman, I know you've had, you and the rest of your colleagues have had some very difficult months. I imagine it has taken its toll.
It's been very busy. People are very tired. And the one thing I can really do is ask for the support of the public. We're working very hard that if you get sick, that we're gonna get you better, that we're gonna keep something bad from happening. We can do our jobs better if there are fewer of you in our hospitals. We need the support of people masking, social distancing, and helping to stop the spread of this virus so we can do our jobs correctly and we can take care of you in the best way possible.
All right.
We're almost done with this pandemic. There's a light at the end of the tunnel. We just need a few more months of effort.
Well, we certainly hope so, and we thank you for joining us.
Thank you.
Thank you for joining us for WGAL 8 in Focus. For all of us here at WGAL, I'm Susan Shapiro. Be sure to join us next week for WGAL 8 in Focus at 7 o'clock after NBC Nightly News.